is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to this week's installment of the 3L Long-Term Care Lunch and Learn program hosted by Legal Aid's Long-Term Care Ombudsman Program. My name is Angela Zeke, and I am today's moderator. Today's presentation is being recorded. The recording will be placed on our website at www.lablaw.org/LTCO-program. All lines have been muted at this time. If you have a question for one of our speakers, please use the question chat feature if you're joining us online. If you are joining us by phone only, you can submit your questions by email to ltcombudsman@lablaw.org. We will try to respond to all of today's questions during the call. If we run out of time and cannot, we will follow up by email, or you can contact us directly by phone. And we will share that information with you at the end of today's presentation. Before we get started, I wanted to direct your attention to the handout section on your screen. If you are joining us online, there are some handouts that you can go ahead and download and can review at a later time. Today's speakers are Amanda Hamilton and Wayne Ann Cottle, Ombudsman for the 5 and Gateway regions. Legal Aid's Ombudsman program covers the 10 following counties: Bath, Boyd, Carter, Elliott, Greenup, Menifee, Montgomery, Morgan, Lawrence, and Round. So let's go ahead and get started. And Wayne Ann, would you like to start the presentation today?
Thanks, Angela, and thanks to all who are joining us today. Today, we want to speak to the rights that residents have during transfers and discharges, and how some of those rights have temporarily changed during the COVID-19 pandemic. First, I'd like to talk about transfers and discharges in general. You know, you could really refer to these as evictions for long-term care residents, nursing facilities, or their homes. And just like people in the community have protections during evictions, so do people in long-term care. Once someone is admitted into their facility, there are only certain circumstances wherein they can be involuntarily removed. Those reasons are laid out very plainly in federal and state law. I want to preface this by saying that these protections mainly apply to nursing facilities and personal care homes. There aren't quite as many protections for folks in family care homes. If you have a question about family care homes, you're welcome to give us a call. First reason I want to talk about is that the discharge is necessary for resident welfare. Now, this can mean a lot of things. A lot of times, it means that the resident needs hospitalization for some reason. That, of course, is a temporary situation, hopefully. But sometimes you'll see this, you'll see facilities attempt to discharge under this reason, claiming that they can't meet the resident's needs. We see this reasoning used a lot of times for residents who have dementia. Maybe they tend to wander into other residents' rooms, or they exhibit behaviors that the facility views as negative. If that's the case, federal guidance says they need to specify what need they cannot meet. In all honesty, there should be few reasons that a nursing facility cannot meet a resident's needs. The only thing that comes to mind for me is later. There are very few facilities in Kentucky equipped to care for someone on a vent. The second reason is a resident's health has improved and they no longer need nursing home level of care. Under most circumstances, I think that would be a good thing. Third, our resident's health has declined and they need a higher level of care. We see this sometimes for residents in a personal care home. A personal care home is really limited on the extent to which they can give direct care, and they aren't required to have nursing staff. So if someone's health declines to the point where they really aren't mobile or they need regular nursing care, it may be time to look at nursing home placement. But I want to make something clear. Once someone is in a nursing facility, like I talked about just a second ago, it is pretty hard legitimately to use this reasoning for trying to evict someone, that their health has declined and they need a higher level of care. There really just should be few reasons, like I said, that a nursing cannot meet a resident's needs. Really, in Kentucky, is really not much of a higher level of care than you're going to find in these nursing homes. Like I said, the ventilator situation is the only one I can think of right off the top of my head. Next, the next reason is that it's necessary for safety and health of other residents. People can be evicted if they are a danger to the health and safety of other residents. Notice I specified other residents. Staff should really be trained on how to handle issues of resident aggression. And, now I'm not saying that I think it's okay for staff to be, hit or whatnot, but sometimes dementia especially can present in ways that mean these kind of situations pop up. And staff should really be trained on how to deal with those. But residents aren't. And the burden of proof here to prove that they're a danger really falls to the facility. They're going to have to lay out how this resident is a danger. The next reason is non-payment. You absolutely must pay your nursing home bill. All right. But I'd like to point out, though, that there are some protections for you. If you have an application pending with Medicaid, most of the time you should be exempt from discharge while that's pending. I see this reason a lot. Maybe most of the discharges I deal with, probably for me personally, are non-payment discharges. Sometimes there could be exploitation going on and someone is exploiting the resident and using their money for other things. Sometimes there are paperwork problems that hold up a Medicaid application for a long time, and then the bills start to pile up. What I want folks to know is that our program is here to discuss all the financial issues surrounding paying for long-term care. We can walk you through the Medicaid process, help you understand all the programs that are out there to help people pay for long-term care, and help you with any problems with your Medicaid applications that might happen. And the last thing I want to point out is that all discharges, no matter the reason, require a written notice. Every single resident in Kentucky also has the right to appeal their discharge. It doesn't matter if you've only been in the facility one day, you are due a written notice. Now, once you've been in the facility for 30 days, you're due a 30-day notice, unless safety or medical reasons call for immediate transfer. But remember, even if the facility is claiming that your transfer for whatever reason needs to be immediate, you still have appeal rights. Just keep in mind, once you receive that written notice, you only have 15 days to appeal. Now, we can help you with this appeal process. If you're someone you know gets a notice, or you're just told that you're going to have to leave, sometimes that happens. Please call us as soon as you can. Okay? Thank you.
I wanted to pause for just a moment and remind our attendees to submit a question using the question chat feature if you've joined us online, or you can email your question to us at ltcombudsman@lablaw.org. Thank you.
So Wayne Ann did a great job of explaining transfer and discharge regulations, but we just wanted to take some time to discuss what things are different with COVID-19. So with COVID-19, a lot of things have changed, even in our own lives. Because of the ever-changing needs, some of the nursing home rules have temporarily changed in some ways in 2019. The first one that we want to talk about is there is no discharge for non-payment at this time. As Wayne Ann mentioned, one of the reasons you can be discharged typically from a nursing home is for non-payment, because there are so many factors that can cause someone to not be able to pay that are only made worse by COVID. You can't be discharged at this time. And this was implemented along with some regulations that prevent evictions from housing for due to non-payment at this time. Some agencies that we work really closely with have worked really hard to put this into law to help protect people to stay in their housing. The next one is Medicaid bed hold days. And when we talk about bed hold days, that is, the number of days a year that you are able to be out of the facility and have your bed held. So typically Medicaid allows 14 bed hold days per year. And now during the COVID pandemic, the Center for Medicaid Services has changed this to 30 days to accommodate, changing needs and care. For the next one, residents may be transferred to different rooms in order to create temporary COVID quarantine units in the facility. So typically, when we look at resident rights, we want to protect residents from having their rights violated by moving them without first asking them or making arrangements to do orientation with them and allowing them involved in the decision. With COVID, it's become important to make sure that quarantine is possible and the residents stay as safe as possible. So the facilities have been given a little more leeway from OIG to move residents to accommodate these changing needs for quarantine units. Another thing that's come with the COVID pandemic, facilities must certify that they can meet the CMS COVID control standards before they accept residents or readmit current residents into the facility. Though it's important to make sure residents get into nursing homes or that they're able to return to their home facility, they're just wanting to make sure that facilities have stringent rules to make sure that they can properly take care of the residents. Something that's really important to remember, this next bullet point, no COVID testing is required for admittance or readmittance if someone is not showing signs of COVID and there's no reason to suspect that the person may be infected. This is something that we have heard a lot and worked with a lot of residents that facilities are asking them, requiring that they are tested before they come to the facility. And they are not symptomatic and they just, are not, they don't want to take the test or not able to be given the test. So it is not a requirement to come to the facility. Now you can expect that when you come into a facility or are readmitted, you could be quarantined for 14 days. Most facilities are doing a 14-day quarantine to new admissions or people coming back from the hospital just to make sure that they are not symptomatic.
All right, great. Well, before we move on to the questions, the question part of our presentation today, I am going to launch a poll for everyone to take. So if you are joining us online, you should see that the poll is now open. And the question reads, can a resident be discharged for failing to comply with a COVID-19 quarantine restriction? So we'll take a few moments for everyone to answer the question. You can just select your option. And again, we'll just have a few more minutes here as we tally the results. Okay, so we're going to close the poll. And Wayne Ann, we have 25% of our participants stating yes, they can be discharged, and 75% saying no in all cases. We had no one vote for no, but only if they have dementia or Alzheimer's. So would you like to shed a little more light on this particular subject?
Sure. Well, in simplest terms, a nursing home can attempt to discharge any person they want. Okay. I can't really give you a black and white answer here. You do have the right to refuse quarantine. You don't have to go to quarantine. But I'll be honest and blunt. One of the things I mentioned earlier was, endangering the health and safety of other residents and how that's a permissible reason to discharge someone. I think the facility could make an argument in this case, but you still have appeal rights. So at the end of the day, like I said, I can't give you an answer, that's written in stone. Absolutely they can't, or absolutely they can. I think it's a case where you would need to appeal and basically see what the judge says. Part of what we do is help you appeal. So you reach out to us if this is your situation, and we can discuss your options and go with you from there.
Thank you, Wayne Ann. We have received some questions, a question online or through our email, and then we've received some through our chat. Wayne Ann, this individual says that their mother is in a hospital rehab center, and they've been told that she needs to go home because she isn't progressing. She was apparently very active before she had her stroke, and the individual believes that the facility is not working with her like they should. They also believe that they are not helping her to eat because she's apparently losing some weight. And she doesn't know, of course, what's going on because she can't be there. She says that her dad can't care for her mother, and they haven't done any type of counseling or assistance with him to prepare her for the transfer home. This is a concerning situation. What kind of advice can you give this individual?
Okay. All right. So I see several issues here. Is a hospital rehab, Angela?
Yes.
Okay. So I'll touch first on this whole idea of not progressing. So it's important to remember, this rehab unit is at a hospital, but the beds in this hospital unit are licensed just like every nursing home bed. So, and sometimes these rehab units, they forget that sometimes. So all the resident rights protections that apply to those beds or nursing home beds, they apply to those beds too. Further, there was a lawsuit several years ago that kind of settled the issue of, do you have to always be progressing in order to have therapy? And the answer was no. So, therapy, Medicare will pay for therapy, to maintain your skill level. You don't always have to be improving. So, I know that no one is going to live in a hospital rehab unit just so they can maintain long term. But I wanted to point that out. Let me also point out, like I said, a facility can attempt to discharge someone for any reason they choose, but it has to be done in a regulatory appropriate manner, or however you want to put that. So they can issue a discharge notice. But if your mom feels like she needs more therapy, she can appeal that discharge. If Medicare is paying for this therapy, I'm going to go out on a limb and assume they are. There's an organization called KEPRO that would take that appeal. And it's a simple process. The first appeal for that is basically just a phone call. They do the work for that. And we can get you that phone number. These appeal rights even apply for folks in a Medicare Advantage plan, but the process is a little different. Once again, we can walk you through that if your mom's on an Advantage plan. And keep in mind, you must have a written notice. In this case, they're going to be required to give you 2 notices. One is a discharge from therapy, with a date that your therapy is going to end, and then the other is a discharge from the facility. We can help you with both. But now, more concerning, I think, is the losing weight. If you feel like your mother has been neglected, in other words, the staff is not helping her eat, and they should be, I would suggest a call to Adult Protective Services might be a good idea, and probably also the Inspector General, and we can get you those numbers. And lastly was wanting to know how to take care of your mom, needing to know how to take care of her when she gets home. Resident rights regulations, they talk about, one of the requirements is discharge orientation. You should be well prepared for discharge, and that's going to look different for everybody. Some people might do fine with a packet of information that they take home and read and has some written instructions. Some people are going to need some real hands-on education in order to go home and be successful. I will point out that there are programs available to help seniors at home in exactly these situations. Every area of Kentucky has what's called an Aging and Disability Resource Center. The people in these centers, it's a one-stop shop, and they can tell you about all the kind of resources that are available to help you. Programs that pay for someone to come in every now and then, maybe give your dad a break, come in and help take care of your mom so he can run errands and whatnot. There are programs available that would help pay to build a ramp coming into the house if she's going to have to be in a wheelchair now. There are programs aimed at providing services and help paying for it so your mom can stay home rather than possibly in the future having to go into a nursing home. Excuse me. Angela, I'm assuming we'll follow up with this person and get them the numbers I've talked about. If someone else would like these numbers, obviously reach out to us and we can get you that information.
Thank you, Wayne Ann. Amanda, we received a question prior to your section of the presentation, and you touched on this a little bit, but I thought it was important to go ahead and ask. My aunt was sent out to the hospital from the nursing home. Now they won't take her back without a COVID test. She doesn't have any symptoms, and the doctor says there's no reason to give her a test. My uncle cannot care for her at home. Where can she go?
Well, the most important thing to note about this is when you ask where can she go, she should be able to return to the nursing home because this is her home. And it, as we discussed, it is not a requirement for her to be tested to be able to return to the nursing home. And, honestly, in speaking with facilities and speaking with the hospitals and the health departments, it's most likely that they will not give her a test if she's not symptomatic because they are trying to conserve the test as much as possible. And they are not going to, what they feel like would be waste a test on someone who's not symptomatic, hasn't been out of the country, hasn't been exposed. So the short answer is she does not have to have a test to return to the facility. If you feel like they're not allowing her back to the facility because she hasn't had this test or she cannot get the test, then we would consider that an illegal discharge. And, as we discussed, there's an appeal process. You can contact her ombudsman, whether it be myself or Wayne Ann. I'm not sure which area this person's from. And we will help with an appeal process. As we mentioned, it's important to make sure that, we meet these appeal deadlines. If she's been given a 30-day notice, she has 15 days to appeal. And, with the discharges, sometimes they're different what kind of notice they give them, but she still has her appeal rights. So if you contact your ombudsman, we can assist you with appealing the discharge.
Thank you, Amanda. Wayne Ann, we just got a question, and it appears to be kind of an emergency situation. So I'm glad that we're able to answer this question today. It says, my mother the nursing home's trying to discharge my mother from the facility, saying she's having behaviors they cannot handle. They told us they want us to come pick her up tomorrow. Can they do this, and what can we do?
Well, can they do it? Well, I mean, like I said before, they can try. I would not say that this is a legal discharge. No matter the reason, she is due a written notice. And at the same time, remember, like I said, you have the right to appeal. Behaviors they can't handle. I spoke before, they need to clarify what those are. Most of the time, we find that they really, really have not done everything they can to try to figure out how to meet that need. You know, activities are important here. You know, have they provided activities specific to this person? Because, you know, boredom, especially with dementia, can really lead to these type of negative outcomes. So, and when it comes to activities, you know, just telling someone about bingo on Tuesday afternoon, that doesn't cut it. So, you know, have they really made an effort to engage this person with meaningful activities? And like I said, you know, there really shouldn't be a behavior that they can't deal with. That's rare. And I will say this too, you know, we talked in I think the first session of these that we did, that, you know, there is no staffing requirement for number of staff required in Kentucky facilities. But the way the regulation is written, it's kind of a double-edged sword for facilities, especially in this case, because the regulation says they're required to have enough staff to meet resident needs. So if this resident's behavior, if the facility wants to try to say that, you know, it's too staff intensive, we need to put someone with them at all times, we call those one-on-ones. Well, I think the argument can be made here that the way the regulation is written, to meet this resident's need, they might need one-on-one care. And so, you know, I think the argument could be made that that's what's required. I would really encourage you to reach out to us, to give us a call, or we can maybe call you back if we've got your contact info, and discuss this further. We can help you appeal this. But I want to throw in, I would not go. I think you say you need to come pick her up. I would not recommend you do that. Certainly not without discussing this with us further.
Thank you, Wayne Ann. There is one question that we didn't get to, and we will follow up with that individual. I wanted to thank you for joining us today for our 3L program on transfer and discharge rights. If you have a question and would still like to submit that, we ask that you please do so by email at ltcombudsman@lablaw.org. You may reach out to Wayne Ann or to Amanda as well. Wayne Ann's phone number is 606-755-0006. And Amanda's number is 606-780-2258. Again, Wayne Ann, 606-755-0006, and Amanda, 606-780-2258. We hope that you all will join us next week on May 14th at noon for our next 3L program. We will have a special guest, legal aids Andrew Lakin, an attorney who will be presenting information about power of attorney and last will and testaments. Thank each of you again for joining us today, and we hope to see you again next week. Thank you.